Okay, so I'm back. What did I say earlier? I told you I'd had my unfill today, and I double checked the cc's on that. I was at 3.9 cc's and he took out 2. So I have 1.9 cc's in my band right now. And I think that should do okay for the surgery. And let's see, my appointment then with the plastic surgeon today was good. I went through all the things with the nurse for pre-op, and she gave me information to call into the hospital, and I can do all my pre-paperwork online. My surgery will actually be in a hospital, and that's where I wanted it to be, not in just a remote site away from a hospital. It's a surgery center within a hospital. And let's see, here is my pre-op orders. It says I should have my arms elevated on 2 to 3 pillows to shoulder level as much as possible. This is of course for after surgery. Apply ice packs to my upper arms for the first 24 hours. The ice pack should be on for 20 minutes every 2 hours. Wrap the ice pack in a washcloth. Do not put it directly on my skin. Keep the ACE wraps in place until instructed otherwise. They'll put ACE bandages around both arms when I'm done, and that's to help keep the tissue pushed together. It'll heal better that way. I'll have stitches, layers of stitches on the inside of my arm, but no layer or no stitches on the very outside. It heals better, they said, and the pressure from the ACE bandage helps to promote that healing. I'll also have drains in both sides. It will be necessary to maintain some type of compression, either with an ACE wrap or a compression garment as instructed. And she showed me the compression garments that I'll wear after the drains come out. Then I'll be able to do the compression garment rather than the ACE bandage. I'll have drainage tubes. The discharge nurse will give me instructions. Empty and charge the drains at least every 6 hours. It's important to keep a daily record of the amount that drains into each drain. Bring this to every single one of my post-op visits. And we did a couple trial run-throughs on how to set the bulbs with the drain, and how to measure it, how to pour it out, and then to squeeze the bulb so that it stays tight with the suction, because if you just leave the bulb open, then it doesn't have suction and pull to pull out the junk that you want to come out from the drain. After surgery, my upper arms will be tender and maybe even bruised. Expect to have the swelling peak in 4 to 5 days, and then it decreases over the next few days. The higher up I can keep my arms elevated above my heart, the better I am to reduce the swelling. They said stay on top of that, because once they swell, it's much harder to decrease the swelling, so keep them up. No heavy lifting. That means greater than 5 pounds, or strenuous exercise until instructed to do so. I can shower 48 hours after surgery, and she gave me a tip. Take a dish towel and put it around my neck. Why does my camera do that? I hate that. Drape a dish towel around my neck, and then I can pin the drains to each side of the dish rag or dish towel, and so then I can move my arms more freely than if the drains were pinned to my arms. To promote optimal healing, of course, eat a well-balanced diet, lots of fluids, lots of protein, and of course no aspirin or aspirin-containing compounds, no ibuprofen for 2 weeks after surgery. After the steri strips are removed, I may cleanse incisions with soap and water, then apply a thin layer of Neosporin twice a day to all suture lines. Once the scabs are gone and open areas are closed, massage the incisions twice a day with vitamin E cream. It takes 10 to 12 months for the scars to mature. During that time, protect from sunlight. And she said, just because she knows that I'm a sun goddess and I love the sun, she said just 11 months, and then after that I can get all the sun on it I want, but I can really screw up the results if I tan on it this summer. So I have to use a high sunscreen and not lay on my stomach, you know, where the back of my arms will get a lot of sun, even with sunscreen on. She says it should stay nice and pink, and by 11 months it should be the natural color of my skin. and she's seen a lot of people that tan and end up with a big dark brown line permanently on their scars. And then, of course, notify my surgeon if I have severe pain, fever greater than 101, redness or a hot feeling, a foul smell, drainage, or any questions or concerns. Let's see, what else did she tell me that might go along with that? I have to go in my surgery will be on Thursday. I have to go in Friday, the day following, for a checkup, and they'll take a look at everything. And then I'll be using a Q-tip while the drains are in after 48 hours to use a Q-tip with some soap and water to clean around the drain site, and then put a small bit of Neosporin on it. And then eventually I'll be doing the same thing up and down the incision. But like I said, I can shower after 48 hours, and that surprised me. I can't drive until I'm off the pain medicine and actually feel like I can turn the steering wheel. Let's see. This is for my post-op, what I should be doing now. I can't take, and this should have been for 2 weeks. They went over these with me last week when I was there, so I already knew most of these. I can't have ibuprofen, Motrin, herbal remedies, Metabolite, Fen-Phen Redux, high doses of vitamin E or garlic 10 days prior to surgery. I can take Tylenol. I do not have to have lab work for this particular procedure. Under special circumstances, stronger pain medicine may be prescribed. I don't think I'll need that. MPO prior to surgery. Use a antibacterial soap the night before and the morning of surgery. No makeup, no nail polish, no jewelry. They gave me prescriptions. I'll go over those in just a minute. I'll dig them out, so I have my prescriptions already. I signed the informed consent, which, of course, if you've ever read an informed consent page, they scare the hell out of you. I'm not having liposuction. He doesn't think I need liposuction. So that was pretty much my instructions. I got something on caring for my drain, and it's got pictures on it. Shows me how to do it. Here's my drain record, and here's my prescriptions. I'm supposed to fill those prior to surgery and bring them with me because one of them's for nausea. I've got Keflex for 7 days. I've got Phenagrin ordered orally, and I have suppositories on hand too. That's for nausea. And Percocet for pain. Hopefully I won't need those. Typically I don't need a whole lot. I'll stay on top of it at first so that it doesn't get out of control, but then we'll see. And then there's a big list again of all the things I'm not supposed to have prior to surgery for 10 days. And flaxseed oil, fish oil capsules, the other stuff I already read, red clover, St. John's wort, Toradol, ginkgo biloba, ginger. Anyway, if you decide to have surgery, they'll explain all what their requirements are. And let's see, what else? As far as cost goes, I will share that with you. You know, it'll be different depending on where your surgeon is. The surgeon's fee itself was $3,000 to the surgeon. The facility fee to use the surgery center at the hospital is $1,500, and the anesthesia fee is $705. If I was having liposuction, it would be additional charges. So the total is $5,205. Let's see. I think that is all of that. The informed consent page, I'm not going to read it all to you because it's 6 pages long, but it informs you everything from the risk, bleeding, infection, change in sensation in the arm, skin contour irregularities, skin discoloration, skin sensitivity, fat necrosis, damage to deeper structure, scarring, surgical anesthesia, asymmetry, delayed healing, allergic reactions, seroma, shock, surgical wetting solutions, unsatisfactory results, pain, deep vein thrombosis, in other words, blood clots. Talks about long-term results, metabolic status of massive weight loss patients. I had to sign that I was a non-smoker. Stuff about female patients, intimate relations. I didn't know this. Even after like cesarean sections, I thought the reason you couldn't have sexual relations was just because of you just gave birth. But anytime you have surgery, surgery involves coagulating of blood vessels and increased activity of any kind may open these vessels, leading to bleeding or hematoma. Activity that increases your pulse or heart rate may cause additional bruising, swelling, or the need to return to surgery and control the bleeding. It's wise to refrain from sexual activity until your physician states it's safe, even though it was arm surgery. That's really about it. That's listed in there. Now, the really cool things that happened today, I got to meet the lady that I told you about was coming in to let me take a look at her arms, and that was so cool that she came in. She actually put on a gown that showed her arms, and she has lost 130 pounds, and her arms look magnificent. They showed me her before pictures, and they were not quite as large as mine are, but she's a smaller person to begin with, just overall in her stature. But she had some pretty loose skin hanging there, and her arms look very nice. She's only 4 weeks out is what she told me, and her scars are almost perfectly healed. Of course, you know, they're still pretty visible and a little pinkish purple, but they're healed so nice for just 4 weeks. And she's just tickled pink. She also has had a tummy tuck, and I forgot what kind you call it, but it was like a 6-hour surgery. And anyway, that was very sweet for her to come in and want to take the time to let another patient see exactly what the results could look like. And the nurse told me my arms, I don't know, I forgot what you call it, but the way that my arms are made, it makes me a good candidate and probably could have results like hers if I follow the rules and wear my bandages and things like that. So let's see. Seems like, oh, she took pictures. The nurse took pictures of my arms, so I have my before pictures now, and I'll take some here at home too. And I haven't done the measurements yet, but I'll have pictures of that, so when I put together my before and after shots. I have had a cough, like bronchial type stuff. I had the nurse at work today listen, and she said my left lower lobe sounded a little peculiar, and I've made a doctor's appointment, and I'm gonna hopefully get started on some antibiotics and then follow up with the doctor again next Tuesday, just to make sure that my lungs seem healthy enough for the surgery. I mean, I'm not having a terrible cough, and I don't have a fever, but I still have coughed up some little tiny bits of yucky green stuff, so I want to make sure that I'm in tip-top shape before I would have any kind of anesthesia or surgery. And I think that's it. If it seems like I'm leaving something out and you have questions, feel free to let me know. I tried to cover most of the things that I know so far about surgery. I'll have a friend with me that day, and hopefully I'll have some video or some pictures from the day of surgery. And I think that's it. Well, wish me luck with only 2 cc's in my band, that I can keep it together and get through this without any major significant weight gain. I'll try and stay focused, and I think that's it. So I'm excited. I'm extremely nervous. Please, please keep me in your thoughts, your prayers, whatever it is that you do, but I can use all the good vibes that I can get. I never thought I'd be somebody to do a cosmetic procedure, and it feels very strange to be going through something like this with the end result not to technically make me healthier. So I'm a little, or I'm not gonna lie, I'm a lot apprehensive about doing it, but I've not had any complications with any other surgery I've ever had, and I've had 4 C-sections, an appendectomy, and my gallbladder and my lap band. So hopefully my good luck, or whatever it is, won't run out with this, and everything will go uneventfully and smoothly, and I'm just hoping. So anyway, this video is long. I'm probably going to have to edit. See ya.